Okay. Hey, I am JoDee. I'm a certified doula and gosh, a bunch of different traditional healthcare worker titles along with lactation. My passion is birth work. I really enjoy it. Iris might pop in. I think it's really fitting because as a doula, you just kind of have to learn to pivot, and she's helping some patients right now that just needed something unexpectedly. So it's me for now. I've been a doula under the Good Shepherd capacity for about 3 years. And I'm really excited about it. I love it. And it's a much needed thing, resource. So we'll get to technical. What is a doula? So it comes from a Greek word meaning a woman who serves. And the definition is a trained professional who provides continuous physical, emotional, and informational support to the client before, during, and shortly after birth. So there's many types of doulas out there. As we say, a birth doula. And that is someone in the birth process. We're in the laboring room. Again, that emotional support. We're doing informational positions, breathing techniques. So we are there shortly after childbirth as well. Really talking about the importance of skin to skin, lactation. There's also postpartum doula, and this is after childbirth. You'll see kind of a vary of roles. There are some postpartum doulas that will stay in your house and help look after baby. I have not seen any in the area, bigger cities. You'll see a lot of these out there. And they just help parents adjust, get some rest, some much needed rest. There's also the community doula, and that is kind of the CHW, the community health worker and doula kind of mixed. They're community-based. They offer free services, getting connected to resources. We're kind of like all three of those, except for no overnight postpartums. There's the end of life doula, which there was actually a lunch and learn on that a while back ago. And I'm one of those as well. I think it helps with just the all aspects of like pregnancy loss. If there's like termination, there's just, it really helps just get that full scope of the doula. So I kind of touched on how we provide support. So prenatally, we are there. We're giving them information on breathing techniques. You really want to start that early on so it becomes second nature. We talk about what I like to call birth goals, because as we know, birth plans sometimes don't go the way we want them, and kind of get them familiar with the process of birth. Sometimes we'll do tours of labor and delivery, and they can meet the nurses. It's just kind of building that relationship. And then in labor, which is my favorite part, is we are there, we're help kind of coaching, giving that positive feedback to them. You're helping their support people, kind of giving them like tips and tricks on maybe counter pressures, or if you notice like mom's going through a contraction and spouse or partner is like talking, you're kind of, ease the support people into it. Postpartum, I like to focus a lot on mental health. just encouraging people to rest and self-care and be mindful of how they feel, and if they are feeling some type of way, to reach out to people. There is support. There are people to help. Breastfeeding is another. Lactation, it's natural, but it's not something you just know. It's something you and baby have to learn. And each pregnancy, each baby is different as far as lactation. So what do doulas do and what we don't do? So we do provide emotional, physical, and informational support. We advocate for the birthing person's wishes, which I put a little asterisk because you want to empower the patient to speak for themselves. I'm not here to be that sounding piece. It really needs to come from the patient. A good doula won't speak for their patient, I feel like. If you're feeling shy or uncomfortable, there's workarounds, but really patient's in charge, the mother's in charge. We help the partner and support people feel more confident in their role. And what we don't do is we don't give medical advice. We're non-medical. We know a lot about the processes, but again, not medical. And we don't replace the doctors, nurses, or midwives. What we do is we enhance the care, I believe. It's a good team effort. It's a really great relationship up on labor and delivery. One birth, we were changing positions like every 10 minutes. Like, she wasn't progressing, really wanted a vaginal birth. So we were in there, we were making it happen. There's techniques to help this, and people just might not know that every day. And again, you don't speak for the patient. They're really in control. A lot of times we'll use like a code word in case they need a pivot. Say they want like a natural birth and they decide like, nope, not for me. And so that code word kind of gives us that idea of, okay, let's talk other coping strategies. So how do doulas impact labor outcomes? Amazingly, research shows that the presence of a doula can lead to shorter labors, decreased need for pain relief medication, lower C-section rates, higher satisfaction rates and birth experiences, and just better emotional recovery, postpartum, and overall improved births. I think gone are the days the family doctors delivering your baby. Having a doula is someone that's there throughout the whole experience. So some doula data. This was back in 2017. There's a lot of research coming up. I really feel like the doula is becoming a movement. You're going to see a lot more out there. The UK has done some amazing research showing just the impacts it has with reduction of the length of labor and C-sections. So just keep your eyes peeled. It's pretty amazing. Oh, some myths and misconceptions about doulas. Doulas only support unmedicated births. That's a myth. We support all births. I love an epidural. You can still move and you can still support patients. There's peanut balls. There's amazing things. It's, not my birth. It's your birth, and how you want to birth is how I'm going to help. So if you want an epidural, I'm going to help get you through that. If you want a natural, I'm here to get you through that. But yeah, we help everyone. A doula will replace my partner. I've heard this. They say, I have great support, I'm good, but it just kind of adds a little bit of, maybe it's like a cherry on top. Like I'm helping family, I'm helping partner, I'm helping patient. I had a birth, I saw she was upstairs, I went to check on her, and it was go time. And I'm like, do you want me to stay? I'm like, please, 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 let me stay. She's like, yes. So I stayed, and beautiful birth. She did great. Afterwards, she's like, JoDee, I didn't think I needed a doula, but I'm so happy I had one. And like, just best thing ever. So it does. You can have all the support in the world, but you have that consistent person that's been throughout the pregnancy and just has that knowledge and who has that relationship with the nurses and the doctors as well. So, we enhance that support. Oh, only hippies hire doulas. No, not necessarily. I might be called a hippie once in a while. I do take, I'm not quite, maybe, but that's not, I don't break out the sage and wind chimes at birth typically, but we do work at hospitals and birth centers, and it really is a movement. You'll see doulas on all scopes. I've already had a baby. I don't need a doula. No, everyone deserves a doula. Again, I've helped people with multiple babies, and every birth is different. There might have been some trauma in past births that I can help make a better experience. So, yeah, everyone needs a doula. Okay, who benefits? So, partners and support people. It's just kind of navigating through it. It's that person. It's amazing how just eye contact will reassure people. A doctor or a nurse will be talking and you make that eye contact and, reassure they're in good hands. We help with logistics. Again, that advocacy, it's kind of a heavy word, but we make sure people feel supported is the main thing. And all the people in the room, it's kind of interesting who goes in the room. Some people like a party. So people have like amazing playlists. Those are my favorite. There's some, and also my favorite is just like mom and dad, and it's intimate and sweet and beautiful. And then babies. Babies, they benefit from doulas. There's lower rates of NICU. The APGAR scores are better. Breastfeeding, again, we're there to kind of help support. And then, that maternal stress. It's a big one. Marginalized and at-risk populations. So, because of that relationship, we might hear things that others might not. So we can see if there are disparities or if there's needs that need to be met. But that community doula aspect, connecting people to resources. Also very trauma-informed and training. And then hospitals. Hospitals benefit from doulas. So lower medical interventions, better patient satisfaction, decreased postpartum complications and readmissions. I think it's a team effort. I've been blessed with having a great relationship with the OBs and the nurses and the staff at the Women's Center. They've been all really supportive. I think in past times, maybe doulas got a bad rap, but trainings now are pretty good about just the integration. We're not working against, we're working with. Again, emotional, physical, informational. I tell people I might not know everything, but I will research. It's kind of my that hyper-focus thing that I love. There was someone, they wanted a placenta print. I had not done that yet. So I researched, we had all the stuff. Unfortunately, the placenta did not come out as well as we'd like, but now I know in the future, if you want a print of your placenta, how to do so. Again, emotional support. Yeah, birth can be intense. There's a lot of emotions. Having someone there that you feel confident in really makes a difference. Again, breathing, massage, positions, coping mechanisms. There's birth combs. I have my doula bag of tricks, what I call them. It's like Mary Poppins. I got some essential oils, although that kind of sounds like a hippie. I have like scalp massager. Just to get your mind off of things. It's really, I think labor's a lot. Natural labor is a big headspace game. Like it's a lot of mental. So you again want to prepare for those natural coping strategies. And then information. Just explaining procedures. If they get induced, what that might look like. If they have to pivot to a C-section, what that might look like. That's it, and I'm really good on time. So birth doulas play a crucial role in enhancing childbirth experience for both patients and hospitals. Their support leads to better outcomes, higher satisfaction. A doula care can bring significant benefits to all involved. Yeah, I agree. That's yeah. Since there is time, I can probably answer questions if anyone has questions. You work with